All right, Halloween is all about costumes, scary decorations, trick-or-treating, horror movies, you know, all that stuff, but candy. Everybody's giving away candy.
But as we all know, candy can take a toll on your smile, depending whether or not you have braces or Invisalign or something else.
And here to guide us through which candy is better for what, so you don't have all your teeth rotting out and falling out and everything else, is our dentist partner, Brightside Dental. Jim is here, Dr. Jim Neme. What's going on? Good to see you.
Good to see you guys. Thanks for having me.
And you also have some friends.
Yeah, introduce who you brought with you.
This is my son, Johnny, and this is my daughter, Louise. These are my youngest of 8.
Wow.
TV
Hi,
ready.
guys.
They look like they're going to anchor a newscast.
They could do it, believe me.
I believe they could. They were over here producing, okay, this is what we're going to do. So they've got it all together. But it's not, completely possible to avoid candy during Halloween, but we can make some better choices, right?
Of course, of course. I don't avoid it, so why would my kids, right?
Of course, absolutely. So, you guys going to help us out?
Yes.
You're going to help us figure out what's better for our teeth?
Yes.
Yeah?
Yes.
All right. So, we'll play a little game. Well, let's do this. What should we avoid if we've got dental work in our mouth? Is there anything that we should stay away from?
As adults? Mm-hmm. Well, if I was an adult and I had a lot of crowns and things like that, anything really chewy could cause an additional visit to the dentist.
Okay.
So you don't want that. Maybe the airheads, maybe not a good choice.
Right here?
Sticky.
Yep, sticky,
Like Laffy
chewy
Taffy,
things.
that kind of stuff?
In fact, we use those types of things in the office to remove crowns when we want to.
Oh, Lord. Wow.
No way.
Oh, yeah, absolutely. We call them jujubes because, the jujube candy. So
Yeah.
anything of
Okay.
that consistency you want to stay away from.
So what about even if we don't have any dental work?
If you don't want dental work, if you don't have any dental work, you really could have anything as long as you brushed and flossed well. Now, what I would avoid would be the blow pops.
Okay. So
And
you guys pick some candy and pick the blow pops out of here and tell me why we should avoid the blow pops.
Well, the blow pops, what you don't want to do is expose your teeth to sugar for long periods of time. For instance, if Johnny opens this up and he puts it in his mouth, and I see him a half hour later and it's still in his mouth, not a good idea, okay? I'd much rather have him eat the Reese's, eat it, brush his teeth, floss, it's all done, we're in good shape.
Okay. So tell me about the candy that you just pulled out, Louise.
I pulled out Airheads and Twix
Tell me why.
because I think they taste really good.
Twix are kind of the bomb.
Twix are definitely more than kind of a bomb.
Yeah.
They are the bomb.
And
Oh, yeah.
Johnny, what did you pick?
Starbursts and a blow pop
Okay, and tell me why.
because Starbursts are good and juicy.
You're good and juicy. So what are some good choices?
Like I said, the chocolate's pretty safe, okay? Even if you have braces or something, it's probably not going to knock the brackets off. You're not going to have to dig it out of there. Just, brush real good and you're all set, okay? So that's probably your safest bet.
What about something going back old school? I know that my mom was crazy for milk duds, and you could basically lock your jaw shut
Yes.
into a milk dud. I mean, are there still candies like milk duds that are bad for you?
Oh yeah, those are tough, Again, you could have them, just brush real good afterwards and you're probably okay.
Okay, so let's talk about Invisalign, which are really popular. I have them. What should I avoid?
Invisalign, number one, everybody knows if you've got Invisalign, your dentist should have told you got to take the aligners out.
Yes.
Because if you try any of this stuff with the aligners in, you got a problem.
Right,
All
right.
right, and you'll find it out real quick. However, you take them out, it's like you don't have anything, really. Sometimes there's some little bumps on your teeth, but they're tiny. You could really have anything just like you were not going through orthodontics at all.
Okay, cool.
So with Invisalign, you're safe. With the brackets and wires, and sometimes those are necessary, but you really do have to be diligent, floss, brush, all that kind of things, and hopefully not knock a bracket off.
Okay.
What about the candy buyback program that's being offered?
Well, been a dentist for 30 years, okay? I've never really seen a big spike in a whole lot of cavities the next day. So, Halloween, enjoy your candy. It's not a problem. I see as a parent that having the candy around for the next 3 months was the real problem. So what we decided at Brightside was, well, let's get the candy to someone who isn't going to get a Halloween. Let's get it to the troops. So we buy back the candy with raffle tickets. Every pound gets a raffle ticket for a special prize. And that way, the candy's not around the house, the kids aren't eating it behind mom and dad's back, and the troops get a Halloween.
That's awesome.
We send everything overseas. We got 9,000 pounds turned in last year alone.
Well, thank you so much on behalf of the troops for that.
Oh,
Absolutely.
yeah.
Absolutely. And thank you
Thank
guys.
them.
Thank you so much. For more information on dental care for you, your kids, or grandkids, and to learn more about the Bright Side Buyback Program, visit their website, brightsidedental.com.
Tanti, did you know that Dr. Jim here, you know, the Bright Side Dental,
Yeah,
he sings that.
Whoa,
He sings
I had
that.
no idea.
I know.
Multi-talented.
I almost had you.
I was going to say you're multi-talented. That's a good one. Next on Live in the D, a weekend of music and inspiration.